Hello, I'm Bill Hearl. I'm chairman of the board of We Vax, and it's my pleasure today to be able to tell you a little bit about this organization and why it is so important that we bring good information about vaccines to the community. Over time, vaccines have been used to eradicate some very difficult diseases, going all the way back to the late 18th century when Jenner discovered that just by being exposed to cowpox, those handmaids, cow maidens, did not get smallpox. And so over time what was discovered is that it was a way to prevent people from getting smallpox, and I believe it was about 1980, smallpox was declared eradicated from the human population. Any number of diseases have been tackled in a similar manner. I think most significantly we can look at polio, going all the way back to the Salk vaccine in the 50s that started to take out this very terrible disease, and now polio is virtually eliminated from the population through the power of vaccines. I think it can be argued that vaccines themselves are one of the great advances in human health, along with things such as the ability to do blood transfusions, penicillin, and other advances that have saved so many lives. We're faced today with a little bit of a challenge in the vaccine space because there's some concern about the safety of vaccines, and there's a lot of information and misinformation that's going out at the moment that is not really giving everybody all the information they need to protect themselves and their family from infectious diseases. So as I'm sure everybody is aware, with COVID-19, the very first thought that people had as soon as COVID-19 was clear it was a problem was, can we get a vaccine for this, and can we beat this virus down in such a way that through a vaccine that we can make daily life normal again? And perhaps you've seen the recent news that there's been excellent progress on the vaccine front for COVID-19, and we're all excited about this progress. But a successful vaccine is only going to be of value to the general population if everybody takes it. You can't have just a few people wanting to protect themselves, because unfortunately human biology is very complicated. And so just because you take a vaccine doesn't always mean that you're going to be immune. You're counting on a significant segment of the population also being immune, so the chances for the virus to spread are limited. So if you combine, say, a solid vaccine program with other mitigating factors, I think it's very important that we do things such as wear masks, avoid large crowds, and do the simple things that help spread. I think it's interesting to me that over time, and I can look back over my career and know that if I could roll out of bed, I was going to work. And I think that it's kind of a mindset that we have to be aware with diseases. If you have a fever, you need to stay home. If your child has a fever, your child needs to stay home from school. These are small things that we can do that add to the value of a vaccine. Well, you've got a very good start by coming to whywevax.org. Our goal for this website is to give you a full understanding of the factors that go into an immune response and what things are important for making a vaccine safe and effective.